ABG numbers are essential data, but they never tell the whole story. While a low or high pH is concerning, the patient's physical presentation is your first indicator of stability. Recognizing these early signs can prevent a clinical crisis before the lab results even arrive. Acidosis often manifests as central nervous system depression, leading to confusion, hypotension, and life-threatening arrhythmias. Conversely, alkalosis triggers neuromuscular excitability, resulting in tingling, muscle cramps, and increased irritability. Both states disrupt cellular function and cardiac stability if left uncorrected. Your primary nursing role is to correlate the pH value directly with the patient's current condition and vital signs. Interventions should target the underlying cause rather than just chasing a specific laboratory number. Remember the golden rule: always treat the patient, not just the pH.